polished and comprehensive lesson transcript, medication management for nursing students. Introduction. As nurses, we are at the forefront of medication administration. While we may not know every medication, we must ensure safety and accuracy in our practice. When faced with unfamiliar medications, we collaborate with pharmacists, consultants, or specialists to gain confidence in prescribing and administration. The nursing role often acts as the final checkpoint to prevent errors, making medication management a crucial skill. Key topics. 1. Tools for medication management. BNF, British National Formulary, accessible on mobile or iPads. This remains the go-to reference for medication information. Familiarize yourself with its layout and how to verify indications, contraindications, and dosages. Royal Pharmaceutical Society Guidelines, post-2017. These guidelines replaced previous frameworks, emphasizing competence-based medication management aligned with pharmaceutical standards. 2. Common concerns in practice. Pressure in clinical settings. Nurses are expected to administer medications accurately despite limited time and high workloads. Advocating for practice opportunities during placements is essential to build competence. Errors in medication. Errors can occur at multiple stages: prescription, dispensing, or administration. Nurses must double-check doses, patient details, and indications. Delegation during placements. If unable to practice medication management, assertively communicate the necessity of gaining this experience to your academic assessor. 3. Fundamentals of safe medication administration. The rights of medication administration. 1. Right patient. 2. Right drug. 3. Right dose. 4. Right time. 5. Right route. 6. Right documentation. 7. Right reason. 8. Right response. Pre-administration checks. Confirm allergies. Assess the patient's ability to swallow, if applicable. Verify recent blood test results for specific drugs. Check previous doses and timing. During administration, explain the purpose of each medication to the patient. Observe for any immediate adverse reactions. Post-administration monitoring. Document accurately. Monitor for side effects or therapeutic effects. 4. Common medications and their uses. Analgesics. Paracetamol, general pain relief. NSAIDs, e.g., ibuprofen, naproxen, anti-inflammatory, but caution with asthmatics and renal patients. Opioids, e.g., morphine, fentanyl, strong pain relief. Risks include respiratory depression, constipation, and addiction. Antibiotics. Penicillin-based, e.g., amoxicillin, commonly used for infections. Nitrofurantoin, specific for UTIs. Always complete the full course to prevent resistance. Anticoagulants. Warfarin requires INR monitoring. Rivaroxaban, apixaban do not require routine INR checks. Antidepressants. SSRIs, e.g., sertraline, citalopram, commonly used for depression and anxiety. Side effects include weight gain, dry mouth, and reduced libido. Proton pump inhibitors, PPIs. Omeprazole, lansoprazole, reduce stomach acid but may cause nutrient deficiencies with long-term use. Bronchodilators. Salbutamol relieves asthma symptoms, but can increase heart rate. Antiemetics. Cyclizine, ondansetron, used for nausea and vomiting. 5. Reporting and managing drug reactions. Yellow card scheme. Used to report adverse drug reactions, ADRs. Established after the thalidomide disaster. ADRs include predictable, type A, and unpredictable, type B, reactions like anaphylaxis. Stevens-Johnson syndrome, SJS. Rare but severe drug reaction causing skin blistering and organ damage. Often linked to antibiotics, NSAIDs, or anticonvulsants. 6. Preparing for prescribing. Non-medical prescribing, NMP. Enables nurses to prescribe within their area of expertise. Requires experience and completion of relevant postgraduate modules. Balances the healthcare system by reducing the burden on doctors. 7. Strategies for building confidence. Use the BNF and online resources like the Electronic Medicines Compendium, EMC. Develop familiarity with medications you frequently encounter during placements. Report all errors or near misses to foster a culture of learning and safety. Questions with answers. General knowledge. 1. What is the primary reference for medication information? The British National Formulary, BNF. 2. What organization provides current guidelines for medication management? The Royal Pharmaceutical Society. Safety practices. 3. What are the rights of medication administration? Right patient, drug, dose, time, route, documentation, reason, response. 4. What should you do if a medication dose seems unusually high? Verify it against the BNF and consult the prescriber. 5. What is the first thing to check on a patient's medication chart? Patient name, date of birth, and recent medication history. Common medications. 6. What is the maximum dose of paracetamol in 24 hours? 4 grams. 7. Which NSAID is safest for most patients? Ibuprofen. 8. What is a common side effect of opioids? Constipation. Antibiotics. 9. What type of reaction should be reported for penicillin allergies? True allergic reactions like anaphylaxis. 10. Why must antibiotics be taken for the full prescribed course? To prevent antibiotic resistance. Anticoagulants. 11. Which anticoagulant requires INR monitoring? Warfarin. 12. What is the INR target range for most patients on warfarin? 2.0 to 3.5. Antidepressants. 13. What class of antidepressants is most commonly used? SSRIs, e.g., sertraline. 14. What is a potential side effect of antidepressants in the initial weeks? Suicidal thoughts. Antiemetics. 15. Which antiemetic is often used post-operatively? Ondansetron. 16. What side effect is common with cyclizine? Drowsiness. Reporting ADRs. 17. What does the yellow card scheme monitor? Adverse drug reactions. 18. What symbol indicates mandatory reporting of all side effects? A black triangle. Case scenarios. 19. What should you do if a patient refuses medication? Document the refusal and inform the prescriber. 20. What action should you take if you administer the wrong dose? Report it immediately as a medication error. Conclusion. Medication management is a complex but vital nursing responsibility. Building confidence requires practice, collaboration, and a strong foundation in pharmacology. With time and experience, you will develop the skills necessary to ensure safe and effective patient care. Always seek support when needed and prioritize patient safety above all.